of our community and of wider US society as we work across all existing societal segments with our sisters and brothers from all other communities, mainstream or minorities, and across any and all divides. It is also an opportunity for us to thank all the women and men in all walks of life, starting with our health workers, first responders, and all those who provide us with essential services. As you all know, a great many of those heroes in healthcare and essential services hail from the ranks of our Arab American community, whether doctors, nurses, technicians, grocery distributors and suppliers, public servants, academics, etc. I can only hope that if there is any silver lining to this global crisis, it will be a stronger realization by a greater number of our fellow citizens of the need to reprioritize and adapt policies in ways that create a more balanced world. I would like now to thank our moderator, Jinan Shabat, as well as our speakers, Dr. Nuha Adudabbeh, and our wonderful board colleague, Dr. Shatha Atiya, who put a huge effort in making this session happen, for accepting to contribute their time, expertise, and wisdom in discussing anxiety, stress, and other issues such as domestic violence in general and in particular during these times of crisis. So without further delay, I yield the virtual floor back to Jinan, an ADC national organizer and community leader who is our moderator today.
Thank you so much, Da. I really appreciate it. Thank you so much for your help in getting this together. And we know that this is an extremely important topic. And we know that we have so many community members who have been looking forward to this and are thanking us for putting this together. So to our doctors who are here to give us their expertise, we truly appreciate the time that you've made in order to give this information to our communities. I'm going to give a brief intro of both of our speakers, and then we're going to do this more of like a talk show style. So I have some questions that I'm going to ask them. The chat box is open for our attendees and participants to ask us any questions that they might have as the program is moving along. And towards the end, we will be able to take some of those questions. So start thinking of those as you hear them speak. So first we have Dr. Nuha Adudabbeh. She's an assistant professor of clinical psychology at the professional psychology program at George Washington University, which is here in Washington, D.C. She's also a consultant at Court Services and Offender Supervision Agency for D.C. She also has a long list of a lot of the work that she has done, and I'm sure she'll reference some of it as she's speaking. And now we have Dr. Shatha Atiya, who is on the ADC board, as was mentioned, and she is a licensed clinical and forensic psychologist and owns a private practice in Fort Lauderdale, Florida. She's also a forensic examiner and an expert testimony in the Broward and Miami-Dade Circuit County courts. I've had a chance to speak to both of our doctors early on as we were planning this, and I know that today we are going to have a lot of really, really great insight from both of them based on the conversation that we had before. So let's start with a very, basic question. We have seen that there is obviously a lot to adapt now that we've been in isolation, many of us for over a month. And it's different for each type of person. I myself am single and I live alone, and I don't have a partner or children that I have to deal with on a daily basis. I have my work that keeps me busy, and then pretty much the rest of the time I'm free. But everybody has their own struggles when it comes to dealing with isolation and coping with how our lives have changed so significantly. So this is for Dr. Shatha. Can you provide us with just an overview of the relationships between stress and overall well-being? Because we know that, as our stress levels get high, it obviously starts to affect different parts of us, both physically, emotionally, and obviously mentally. So if you could please kind of give us a brief overview of that to start.
Sure. Hello to you all. Thank you for having us. Yeah, definitely. All research, all studies show that there is a strong correlation between stress, especially prolonged stress, chronic stress, and our overall well-being, emotional and physical well-being. So, if not managed, then stress can lead to mental illness such as anxiety and depression. It can also lead to many medical problems such as high blood pressure, diabetes, digestive system problems. It can affect your sleep. It can affect your concentration. And most importantly, related to nowadays, it can reduce your immunity system. So that makes us more susceptible to getting sick, fighting viruses or bacterial infections. So that's why it's very crucial at the present time that we manage our stress level.
Absolutely, very true. Dr. Nuha, did you want to add something to that?
Well, I think she covered the part that has something to do with how it impacts us psychologically and medically. I would also like to bring in the spiritual part of this, because this is going to be a very important period in our lives. This is, we're making history. We're living a very unusual period of history. And some people who are older may have gone through this way before and others did not. So this is our challenge to really make either the best out of it or to sink, whichever way. So there are many different ways of coping with it. And I think hopefully we will give some pointers on how to deal best with it during this period. And I'm hoping that most everybody that's listening has already found some ways of coping, to tell you the truth, because we live in an era where you have access to many different kinds of ways of coping with it. I'm hoping that with them having so much time on their hands, that they would be exploring. So the most important thing is that how do you make the best out of this horrid, incredibly difficult situation historically? We are living a very unusual period of history, and it is in little dots of stress. It's like an overwhelming amount of universal stress. And how do we make the best out of it? How do we come out of this with some lessons, hopefully?
Okay. That's actually a very good point, and it transitions into the question I'm going to ask you. So for a lot of our viewers and a lot of people in our community who have families, how does one find the time and space for themselves while being at home with their spouse and their children? And then also in the same form, like what are some things that people can do with their families in order to cope with the stress?
Who's going to answer it first?
Go ahead, doctor.
Okay, this probably is, for me, I'm an ultimate humanist, and I'm thinking actually in a country like this, where the biggest emphasis has been, which I resented the whole time I've been here, on individualism, this chance for coming together as a family and how to make the best out of it. How do you learn to run a family in the healthiest way possible? I know it's being imposed on us, but how do we make this a very enjoyable, challenging, but an enjoyable time to come up with some of the most creative ways we can have wonderful communication, wonderful games to play. And unfortunately, you just have to adjust to the age groups. So we don't know how many of you are stuck with age group, to be perfectly honest. The teenagers are one. Wow, I wish I had some teenagers around me now. I tell you, they would be the most beautiful challenge on earth, because they would be the ones that will be challenging us mostly, probably intellectually and in creativity. And then the younger ones, of course, they might be a little bit easier to deal with, except for the issue of the hyperactivity. I don't know, I hope not too many of you are stuck with hyperactive children. So we have all of these different kinds of situations. And I'm a romantic, so I'm, asking everybody I know, among friends and non-friends, if they could start developing some of the beautiful European styles of family life. I wish people, I know Lebanese, when I say their candles, they will all think of the Civil War and get, ooh, no. Yeah, but I would love to see some candles lit. I'd like to see some flowers put on the table. I'd like to see people create and have each of the children be in charge of one of those items. Create beautiful kind of situations at home. Create, this is the ultimate period of the ability to reach all of your resources, especially creative resources, and come up with some ideas to make every day a little bit different from the day before. And you can always include your children in coming up with the ideas, and maybe have a prize each time for each child. And of course, your kid, which one has which qualities, and encourage those qualities, and have prizes every day, for different accomplishments. I mean, I could come up with a zillion ideas about how to make life more interesting every day when we're stuck together. There's got to be many ways we can make it more fun, more interesting, and closeness. And hopefully you can, well, we will help you today with some of the ideas if you come up with some concrete questions. Okay.
Wonderful. Dr. Shatha, anything to add?
Activities to do with the children. I think depend on the children ages and developmental level. I agree with Dr. Abudabbeh, giving the children responsibilities, empower them, participating in the chores in the house, maybe taking care of the younger ones, or keeping surfaces clean. And make it enjoyable, so they participate in the responsibilities of every day that they're all together in the house. But also part of the fun activities, I think, dancing, singing.
Yes.
Now the spring.
Yes.
Exactly. The spring is here, so they could do gardening. That's very enjoyable. And also playing games together, watching TV, some fun movies that all kids, all our family enjoy together. So there are a lot of things that you can do, and like Dr. Abudabbeh, be creative, your children, but have some activities that get at the like all the kids need to jump and play and get all this hyper activity, whatever is out, and also some calming time like reading stories or watching TV, and so you have a balance. And do your best. You cannot don't get frustrated or over rigid. Just be flexible and enjoy your time with them. It actually is the best time to, now that you have time with your children much more probably than ever before. If you were a working woman or if you were a student, now is the time that you connect at a different level with your children. If they're a college student and came back from college, boy, now you have the best time to sit down and have a deep conversations with them that you always wish to have with them. So be creative and see what your children need and try your best to meet them.
Okay, that is actually wonderful advice. One thing I've seen a lot of my friends, so a lot of my friends are married, they have kids, so posting on social media, a lot of the activities they're doing. There's TikTok, which is a new social media platform where you make like very short dance videos for popular dances that have been shared around social media. And one of my friends from Cleveland has been doing it. Her husband is actually an ER doctor. And when he gets home at night, he actually, with his 2 teenage daughters, will record some TikToks with them. So we've seen that he's been able to connect with his children, even though he's been busy. And I feel like it also helps him as well to kind of decompress and de-stress. And obviously my friend is having a blast laughing at them and sharing it with her social media. So it's been good. So I've seen that with a lot of people, plus cooking. So cooking, I think, is also a good way to get the whole family together and try new recipes. I myself love to cook, so I started a page where I can share my recipes with my friends and get them excited about cooking now that none of us can really go out to dinner or really get takeout because of the the dangers of the food handling. So so that's good. So one other thing, what is it?
Great ideas.
Absolutely.
Yeah. Don't forget baking, not just cooking, baking.
I'm not a very good baker, but
baking.
Baking is always a lot of fun. And you get a very sweet reward at the end, so you can't go wrong with that. So
it's a time to gain new skills Also, it is really, you have all the time in the world to gain new skills to add to some of the skills you already have. Can you imagine how, you know, this is a big advantage of having time. I mean, time can be used in the right way, depending. Yeah.
Okay. Dr. Shatha, so we talked a little bit about the stress and the anxiety. So just so that we can clear the record, because obviously people are on social media and there's different articles that come out all the time. And we know a lot of people want the reassurance of whether or not it's normal for us right now to feel this anxiety and to kind of feel under the threat of what we're facing on a daily basis in our community. Because obviously right now we're seeing the peak across the country and a lot of the deaths due to COVID-19. And so for many of us in our communities, it's only, you know, it's going to get worse before it gets better. And so reassuring, I guess, coming from like a clinical perspective that it's normal, obviously, to be feeling this way and, you know, why it is that it's normal.
Definitely. Anxiety is normal. Actually, little anxiety is quite healthy. We, human beings, were created to fight or flight. So little anxiety prompts us to be careful, extra careful. So in this situation, you know, like isolate, wash your hands, do whatever we need to do to protect ourselves. Little anxiety, let's say if you're having a job interview or you have a test, prompt you to study harder or prepare better for the test so you can perform better. So it is healthy to have a little anxiety. However, there is an optimal level, a threshold that if you exceed that, if it becomes too worrisome that it starts affecting your daily functioning, then you can get into clinical issues and mental health, you know, related problems. So yeah, definitely, you know, feeling scared, feeling afraid, worried, it's our human nature and it's normal. But as long as it's in balance, that is not gonna affect our daily functioning, our concentration, our sleep, and progress a little bit more into the mental illness.
Yes, absolutely. Dr. Nuha, did you want to add
Well,
anything?
you know, I mean, I worry about my community in the sense that it depends on who. People know themselves. Some people already have anxiety. You know, they may have been suffering with it. Now, that's the group that we would be concerned with, in the sense that this, in fact, makes it even worse. But there is a way to cope with it in the sense that we have lots of exercises for people who do feel anxious, you know, breathing in and out. You know, there are lots of different methods to utilize during a period when your anxiety is even increased further. But like Dr. Shatha said, this is a normal time to feel some anxiety, but excessive anxiety clearly is going to interfere with your functioning. And I think the more you come up with other ways of you to, in fact, put that anxiety, you can put it aside to some extent by developing certain strategies. And those are available online even. And then some of people have already probably been in therapy with some therapists and they've learned some coping mechanisms. They can enhance those. And those of you who don't do yoga and some of the other exercises, there's no question about the fact that exercises really help you a great deal. This is a time where really, even if you are stuck at home, you can walk in the house and even calibrate it on your time. You know, you can make some of those commitments towards your mental health. Okay, so you can take that. Yeah. So anxiety, yeah, is normal. Excessive is not good for you. Dr. Shatha explained all of the, you know, impact of that on your general health. So, but there are ways of getting rid of it. You don't have to be stuck with it. You can do.
Yeah, we will discuss it more on relaxation techniques and all that is very important. I wanted to add also that we're humans, so don't be ashamed if you feel anxious or you're afraid. You know, we're not superior. We're just a human being. So accept yourself, be compassionate to yourself, just like you be compassionate to those around you. You really need to be kind to yourself and take the time out when you need to take time out, just like, you know, you take the time to take care of everybody else. You need to take time to take care of yourself and recognize that you do have a little bit of anxiety or it's getting more than a little bit and then you really need to manage it. We're going to give you lots of tips and how to manage it. So that's very important as we go on.
Yeah, actually that's good.
We mental health workers, we also had to work on managing our anxiety as well. We're in the same bag here.
Exactly, and that to bring actually the healthcare providers, the police officers, all the doctors and the nurses and everybody who's working in the hospital. If they don't pay attention to their mental health, if they don't pay attention to managing those stress and fears and worries, they could very easily, you could see a very big surge in post-traumatic stress disorder in a few months. So it's really important, this topic of managing anxiety and the stress is extremely important for everyone, no matter how educated you are, class or race or whoever, you know, or whatever you're doing, it's very important to manage it.
Can you see my flowers here? I'm bringing flowers for everybody. Spring, garden spring to everybody, and wishing you all to work well on being in good health to take care of the rest of the family. I'm talking especially to the women in our community.
Perfect.
Yes, absolutely. So we have like so many questions that are coming in right now. So I want to shift the conversation now to obviously a little bit more of the serious subjects. So obviously we've talked about stress and anxiety, and we've talked about activities for the families. But now we obviously know that there is a lot more that happens in a household and that could happen, whether it's between the spouses and partners or between one of the spouses and the children. There's a lot of tension, especially if you said like there's a lot of age differences. You have teenagers who are a little bit more verbal and can talk back and express their aggression in a little bit more of an adult way, and it can cause some tension between family members. And so one of the things that I want to ask is, you know, some people are asking, like, what do you do in that situation if things become so tense and uncomfortable that it may turn into a violent situation, whether it's between the spouses or between the spouse and children?
Violence, that's my specialty. Okay.
Yes.
Oh my God. Well, you can always de-escalate people. I mean, it only gets worse if both sides are kind of going up together. Whenever you have a situation when one of the people is escalating, the other person is the one that can take even physical distance as far as away as possible, and always using the softest voice in order to say, okay, you know, be as soft as can be. Only one can go up. And then the other person cannot, in a void, keep being violent. I have had to deal with some of the most violent men in Washington, D.C. I have not had hardly any incidents in 40 years, okay? Because there is a way of de-escalating the most violent human being. It has to be done by being softer and kind of, you know, taking and make sure there is a love distance. If you're both in the same room, that person leaves the room. Do not even physically be in front of that person, because that could be triggering some of that, you know, anger and so you say, I'm leaving the room, and you say it in a nice, gentle way. Look, son, I know you're mad at me. I mean, I know you feel like you're gonna beat the shit. Excuse me, you're gonna beat me up. I am now taking a step back. I'm gonna wait until you calm down and you let me know. And hopefully everybody has a phone in their hands. I've had to talk to my gardener by phone from outside inside, so they can always connect, saying, when you're ready, call me and I'll be back. Okay? There are many ways we'll deal with that, with specific situations they can bring to us, but you can always de-escalate, which is not, people are not very prepared to do that, especially men. Men are always wanting to be, one has to be better than the other. One has to be stronger. They always have to show off their power and their ability to fight. You know, it is very tough for a man to let go, but they can learn to do that in a situation of that sort, okay?
Yep, thank you. Dr. Shatha?
It's a complex question. When you're talking about domestic violence, that's a different situation.
Different. Yeah, that's different.
Versus a child who has a tantrum because of the current situation, he's scared, he's afraid, or a teenager So being a parent or a brother or sister to somebody like that, it is more anger management. It is more being compassionate to say, hey, I hear your frustration. I hear you're angry. Let's talk about it. So I think communication is a key skill that perhaps now people are together, they can see each other vulnerability. I can see my son have anger problem or difficulty expressing his emotion, his frustration. Why cannot he see his friends? Why cannot he go to school? Why he cannot see grandma or grandpa? Why are we not going out to our favorite restaurants? So you need to know what is the source, what is the reason that he's angry, and try to teach them, okay, you know, let's calm down, and we're going to talk about that when you calm down. So you give him a chance and teach him that you need to calm down and engage so you can engage in more cognitive, more reasoning. When somebody is angry, you cannot talk to them like the doctor says. You know, I understand you are upset. Let's talk about this later. It's very important, but right now, because you're angry or you're shouting, I'm not going to be able to talk to you. So you give that boundaries. It's very important you teach them boundaries, whether it's a spouse, whether it's a child, whoever it is. But I think part of it is when you show an interest that you really do care about this person, whether it's a spouse, whether it's a child, then you know you show them that you do care. If they're loud and you're loud, you're not going anywhere good. Of course, we don't want to get into anything physical. So this is more when you deal with you know, of course, if you have children and you know, you need to encourage little children to be more expressive. You know, tell me what you're feeling, or show them understanding. I know you must be angry or you must be upset because you're not seeing your friends, because you've been home all this time. So you show them understanding, compassion, that you're listening. I think the best thing we can get out or remember years from now, or our children will remember, is how compassionate, how understanding you were with them, how much fun you were with them at the time when it was a very stressful for the world, and it was a very difficult time. So this is going to be something that our children will remember forever, and so hopefully they will have good memories, and you are a good role model. So if they lose their temper, you say, I understand you're having a difficult time, I understand, and engage them in talking as simple as a little child saying, I'm angry, I'm upset, or an older person to, you know, air out his frustration when you calm down.
Great. Good. Great.
Yes, that is very, very good. So Dr. Shatha, kind of bouncing off of what you were just talking about, especially with the children, so what would be a good time, you know, after dealing with a child continuously who is acting out because of the situation? When would be a good time for professional intervention? So like, you know, it's been a month and your child is still every single day fighting with their siblings, you know, talking back to you and your spouse, acting out, you know, maybe throwing things, you know, trying to leave the house, whatever the case may be. What would be the time for you to maybe introduce, you know, professional intervention, and then what are the resources available right now? Because obviously a lot of the offices are not taking in, you know, walk-ins, but what other options are there?
You're right. Lots of offices are closed, but there are a lot of doctors, psychologists, as well as physicians who are practicing telehealth. So you could actually set an appointment with a professional and take their opinion. I would not wait for, if I see my child needs some anger management or communication skills, or he is highly irritable and I'm not able to communicate with him, or he starts engaging in perhaps, you know, behaviors that are not like maybe drinking or smoking or leaving the house when he is not supposed to, or maybe, you know, becoming aggressive with the children, or then I definitely will contact a professional and say, can you speak with him? Can you see what's going on? Many times we try our best, but many parents, you know, you're not a professional. So when a professional is talking to your child, they can talk to them at different level and assess what's going on. And so
Dr. Shatha, remind them that they can do Skype. You know, some therapists are seeing people
oh yeah,
to see them in person, so that's available.
Oh
And,
yes,
yeah.
telehealth, yes, exactly. Skype, Zoom. I am on Zoom and Doxy.me, so definitely, I think they could search and they could find all these doctors in their area.
Yeah.
And I get national and international on these.
Right.
So you could reach. It's actually easier because you could see them, you could talk to them. It's easier than having to travel. So definitely, I would seek an advice. Maybe that's a good idea also to talk about the stigma. You know, a lot of people think about going to a psychologist is, oh, I'm not crazy. You know, it's a stigma of I have to be crazy or psychotic to be, you know. So it is not. Most of the people we see are dealing with stress, are dealing with issues like divorce or losing a job or family issues, parenting, mood disorders. So it's a lot of normal things that people need some coaching, some direction, and it's very normal to do that because we're not immune or we're not superior. So everybody in their lifetime needs some direction, and being a professional, you know, we're not biased. So we'll give you our honest recommendation, and you practice it, and it's very important, I think.
Yeah.
Okay. Very good. So I guess we have so many questions that are coming in. I don't know if we're going to get to all of them, but we have people that are like, you know, younger people who may have had to move back home from college to stay with their family while their college is out of session. And they want to know what can be done if you are kind of forced back into a toxic situation or environment with your family. Realistically, what are things that you can do within the bounds of like the culture or religion that wouldn't be disrespectful, but would help validate your emotions and the situation that you find yourself in?
This is the teenager asking, or the parents?
Yeah,
teenager. It's a teenager asking.
What age? Well, male, female, age?
Well, it is a female. I know that females, you know, we tend to get a little bit more pushback from the parents when it comes to, you know, wanting to, you know, build ourselves outside of cultural bounds. So it is a female.
It's a female. And she's wondering how to cope with having to be stuck with her family.
Yeah, I mean, being in a toxic situation with family who's constantly
toxic. Is the word being used to hear toxic?
Yes.
Oh my God. Okay. Wow. Okay, that's a tough one.
So, you know, it kind of weighs down on a person mentally. You know, they start to internalize.
No, but I want to know in what way. No, wait. I want to know in what way does she find it toxic? I'm curious.
There was no specifics. It was just saying, like, basically just in a generalized form, though, how can one approach it in a way where it doesn't escalate the situation?
Yeah, but you know, frankly, it sounds like it could have been quote unquote toxic prior to being stuck at home.
Right.
I'm thinking, and of course, it's going to make it much worse while you're having to spend all that time together, and especially if none of that had been resolved at any point in life.
Right.
And this is not unusual, and a lot of especially young girls, teenagers. I don't work with younger folks that much anymore. I only work with young adults, basically. But often the relationship with mom is quite tough for some reason. It's not unusual. You know, it's usually much easier with dad, maybe because time is spent with dad. But often the females have a harder time with mother. That's a very common theme. It's you know, it's based on many different reasons, so we don't know exactly what the situation is here. But I think, you know, she could at least be busy with a whole bunch of stuff that she may not have had the time to deal with earlier. You know, this is her time to really be focused. I don't know, is she going to college? Would the school be another thing? Would she be reading more? Does she have any? I often ask people if they have any hobbies. Would you believe a whole bunch of folks, especially from the new younger generation, have no hobbies?
Hmm.
You know, does she have any hobbies? Is there something that she thoroughly enjoys doing that's besides having to do with the family or with school? You know, like things like photography, which is no longer popular, drawing, designing, a whole bunch of stuff. There are many, embroidery, crochet, you know, some of those people don't even know what I'm talking about. You know, these are some of the things that made life a little bit different in the old days, that people love things that occupied their time in a productive way. So I don't, you know, so she had issues. It's not unusual. Almost a lot of the people I've seen in therapy have had issues with mom, especially the girls, that needed to be worked on for a while. It's not a simple situation. Shatha might have more light to shed on it. She's a whole lot younger than me. She may be closer to that answer than I. So there you go, Dr. Shatha.
Well, I think perhaps more of our culture or other culture like Hispanic or Oriental, it's when parents are trying to parent their child as we were parented, you know, in the Middle East, the very conservative style. Unfortunately, if we understand as a parent that this child now, they've been away for a year, let's say in college, and they've been free. They've been doing whatever they want to do. Now they come back on vacation, or now we're stuck at home together. We are imposing the same rules that we were imposing on them when they were 14 and 15 and 16. Now we're not cognizant of the fact now they are grown up, they are in university or in college, they are basically adults, and we need to treat them like adults, and we need to talk to them like adults. You cannot be an authoritarian saying my way or the highway, because it's not going to work. So for the parent to look at their parenting techniques or their communication skills with their children, because again, going back to many people are extremely stressed out. Many people are extremely scared of what's going to happen. So parents are worried because they're worried about, you know, contracting the virus, or their children or their parents or extended family. But many parents also lost their jobs. Many family, their income cut in half because they're now home. So there are a lot of stresses on the parents. So whether the daughter or the son, the caller is as a female, she has to be also compassionate to the fact that her parents are pretty stressed out. Compassion go both ways. Yeah. At the same time, they have to be cognizant that this child, my daughter, my son, is also very worried. But it's a communication. You know, they need to communicate that to each other. They need to find the time to sit down and talk heart to heart, because that goes a long way, you know, and show respect to your child, just like you expect your child to show respect to you. It's because now it's not a child. Even you need to respect the little child as well, but you need to listen to them. You need to see, what is it that upsetting you about me? What am I saying or doing that is not clicking with you? You know, maybe this is the time that you are together and you have that time to connect and heart to heart. You know, and this is something that perhaps you could also take it to a professional, because the professional will listen to the mother and listen to the child and see the discrepancies, what's going on, and then connect them and teach them how to connect and how to listen and how to answer and not overtalk to each other and get angry and frustrated and give up. Because if it's not repaired, this frustration is going to continue for a very long time, and you don't want to have a relationship like that with your parent or with your daughter or son. So perhaps it's the time now to, since you have the time, to sit down and be a little bit more better listener, and have a little bit more compassionate to the, what is the reason my son or my daughter is, or my mom is frustrated, and let me see things from her perspective, and hopefully she understands my perspective and reach a common ground. Or certain things.
Yeah, it sounds like she is the kind of, I mean, it's going to be tough for them to speak the same language at home, to tell you the truth. When she uses the word toxic, and it would be, you know, like you suggested earlier, it might be one of those situations where the girl would benefit a lot from getting on Skype and getting some feedback about how to bring her mom around. You know, it's going to be tougher to work with the mother than it is. It will be easier to work with the younger one. And that would be the kind of, she could get some pointers in how to handle the situation and maybe use this, you know, environment to improve her relationship with her mother.
Yeah, no, I also would add, toxic could also be very negative environment. And other people actually do have to deal with negative people, negative environment, somebody who's always complaining or always very pessimistic. So if that is the case, then you know, that's a different level of, you know, how can we tolerate somebody who is very negative and let them affect our well-being? Because then that's a very important issue, because we need to understand that, okay, this is their personality, but I cannot handle that. And we need to communicate to them is like, listen, the best way in this situation is to stay positive, because if we're negative, if we're too stressed out and we are negative, we're going to attract the virus. It's going to kill our immune system, and we're going to get sick. So, you know, I respect you being like that, but please around me, I want to stay positive and help me stay positive. I don't want to hear any negativity. So you can be a little bit assertive with people in your environment and say, you know, try to help me be positive, and I try to help you stay positive.
So I think it might be a good time to even recommend, especially if she's a college kid, she could look for some books. That there are so many books written by a daughter-mother relationship, for example. There are many good books to read during this period to help one with dealing with those. It's not unique to one person. These are such interesting themes. You know, this child-parent relationship is the essence of our work, actually. So it would be nice if they could use the time to read some of the books written by other women about their relationship with their mothers. It's a very interesting, intriguing kind of a topic to explore further. And I do suggest to read some of those wonderful books that are out there to read. This is a good time to read, by the way. It's a very good time. You can learn a lot by reading.
Absolutely, I agree. Okay, so I'm going to shift it a little bit now to talk a little bit about domestic violence specifically, because we have a lot of questions about that. So starting off, someone wants to know, in situations like this, with being in isolation and quarantine, are the rates of domestic violence higher than normal? And then for those who are in a domestic violence situation, which we know unfortunately many women are, this brings them in close proximity with their abuser, especially if they're working from home. And so what are some resources, and what are some resources other than police? So we know that some communities struggle with looking to police to be, you know, the source of protection, because some communities are more vulnerable, such as the Black community and immigrant undocumented communities. And so maybe reaching out to the police is not the first thing that they would want to do, because it would put them then in another difficult situation to handle. So if Shatha, you could start maybe by discussing the rise of domestic violence cases right now, and then we can discuss the other parts.
I actually woke up to a text message in the news, from the news on Monday morning, that there were 3 homicide this weekend in different states, 3, where the person killed one girlfriend, one killed his wife with her teenager daughter, the other one killed his ex-wife with a standby neighbor, teenager son who was there. He shot at his ex-wife, and the neighbor accidentally committed suicide. So definitely it is on the rise. It's very unfortunate, and it's very, very sad. Domestic violence is, you know, we're hearing more and more increase because people are together, and they're stressed out. You know, if they don't have a relationship to start with, and now they're all the time together on each other's nerves. And the abuser, and by the way, it could be a man or a woman, the victim. We have more women than men, but actually I have seen and evaluated so many men who have been victims of domestic violence. And men tend to be very ashamed to admit that women hit them or beat them or abuse them physically, emotionally, or sexual abuse. So if you want, you know, understandably, many people don't want to involve the police. Actually, most cases, more than half, I think that a little bit around 54 or something of women actually report abuse. They tend to live with it, normalize it in their mind, and don't reach out for help. It's like a family business. You know, they don't want to involve the police or go further. Abused men tend to report domestic violence more than abused women. Actually, the percentage is higher with men who are abused. So We need to encourage people, women, abuse victims to reach out for help. If somebody does not want to call the police, there is offices of victim services. It's available all over the states. And these services, the offices, they provide you with funding, counseling for the victim, for her children. They also have a liaison to represent you when you have a court case. They prepare you, they provide funding, so they are community outreach, so they give you all the resources to help you stand up on your feet again. There's also NAMI, the National Alliance for Mental Illness. They also provide a lot of help. So in Florida, we have women in distress. They also take in the families and help them. So, you know, try to reach out. It's safety, your safety and your children's safety. It is utmost important. And so I really, my heart, you know, goes out for the victims. And, you know, part of when you reach out for therapy, and I think it's very empowering for women, is when you teach them that they are a survivor. They're no longer a victim. Once they feel that they survived this, they're strong, they survive it, they can move on with their life, and that will uplift their self-esteem. And so part of these services is to help them get a job or an education and therapy, so that will help them to stand on their feet again.
Well,
Dr. Nuha, did you want to add anything?
well, you know, it's not my area of specialty, but I will address this by saying, when we had Naeem Foundation, we did provide a telephone line for any of the women that felt that they were being abused. And actually, we were able to talk a lot of the husbands to come in actually for, you know, marital counseling. I really have been impressed with my community. I'm very biased for my community in terms of seeing them in very positive ways, in the sense that I feel that the men have never had the chance, having grown up in many countries where there was such oppression, they never really, I think, had the confidence to even be an equal partner without probably sometimes using violence or being so aggressive. So there's room for change. I think if there's so much room for, you know, education and change, and I'm glad that Dr. Shatha mentioned a lot of there are many lines for you to reach out and call about, you know, any abuse that you are experiencing without having to call the police. I'm very, very opposed to the idea of calling the police. I know there are times when it is needed, when your life is at stake, for sure. But I, in fact, I work a great deal with African American, and that is the first thing they ever do. I think that's a sign of, at times, weakness. It's a tough call. I think, you know, our community is very hesitant to call the police. Actually, they're not that, you know, they're not inclined towards that choice, which I think is a mature choice in a way. I say that very hesitantly. I'm not encouraging any woman to allow themselves to be in an endangered situation.
Mm-hmm.
They have to really use their minds to decide how endangered they are. And basically, the idea of at first reaching out to counseling on the phone at least, and those are available. And frankly, this is a situation where people are going to experience more of the tension that could lead to acting out. No question about it, because we are all in a smaller area and less movement. It has to lead to the potential for violence, and we could maybe learn how to avoid the violence occurring by Dr. Shatha emphasized that. I'm saying what she said earlier, the communication part, you know, enhance. This is your chance to really maybe exercise learning how to talk about feelings, maybe learning how to express your feelings by talking about them. You know, we are a verbal society. We are the people who created so much poetry. We are the very creative people. We are the ones who started many civilizations on this earth. And so we ought to be quite creative during this period. And if we are able to write poetry in such eloquent ways, we're so good with our verbal skills. So this is a time to really put those verbal skills into use by communicating as much as we can with each other to avoid any kind of violence coming about as a result of our being confined in a small area, because it's inevitable. You know, the idea of us being day in, day out together. And those of us, Jinan, we are lucky, the ones who are by ourselves. We're not going to anybody, nor anybody's going to harm us. We're good, you know, we're doing okay. But those of you guys who are stuck together, well, you know, we're asking that you be patient, and talk to each other. Learn how to improve your talking skills, your verbal skills, and believe me, you will really enjoy that. You will probably regret having learned them because you may want to do it all the time anyway. So I say you can avoid by really enhancing the verbal skills and by talking to each other and singing. And maybe some of you who know poetry, read your poetry to each other. Okay.
Okay, I agree with Dr. Adudabbeh about the communication skills and all that. I covered it, I think, pretty well too. However, I have to add the seriousness of domestic violence is different than fights. You know, fights is a normal thing. Disagreement between husband and wife or partners is a normal thing, and we need to learn to communicate better, to listen better. Good listening is very important. It's better than talking. Mirroring what you're hearing. You know, okay, I hear that you're having a problem with this. I hear that you don't, you know, you don't like when I do that. So that's a normal relationship. However, in domestic violence, it is much more pattern. It's a pattern of behaviors that aim to control the victim by the abuser. Part of the control is taking their freedom, reducing their contact with their family and loved ones, having very little money or cut their you know, financial resources. So you're not going to see anybody. He doesn't want you to talk to anyone. You're not allowed to do this. You're not allowed to do that. Sometimes even it goes as bad as they go to a restaurant. He orders what he wants her to eat rather than what she have her involved. So it's a game of control
and power.
Control and power, and it's a violence. There's a violence in it, and there is a sort of like a honeymoon period. After a physical fight, after you know, this is ended, then there's a time when he's, I love you, I am so sorry, and I'm so, you know, I don't know what happened to me, but you're always the reason. So they make the victim feel like they're the reason why he hit her. That's a different relationship than normal relationship when we have with a person, we have normal agreement. So disagreement. So domestic violence is a very...
something else to add to it, why it is much worse than, in the sense that hardly any of our families have an extended family around them, which makes the situation, in fact, more dangerous for the victim of the domestic violence. I mean, I think that you know, we should mention that really takes away from some of the support systems that are needed, that we had, that are not available at this point for a lot of the families.
Yeah. When you're cut off from your support system, or you don't have anybody to turn to, you basically have nobody but the abuser.
Right.
And you don't have a job, you don't have money, you're scared, I have children, what am I going to do, be homeless? And that's why the victim keeps taking and taking and taking until one day he almost beat her to death. And by the way, when a child witnesses a mom being abused physically or, you know, even emotionally, that is legally is a form of child abuse. So the abuser does not have to hit the child to be child abuse. But in court, this child is emotionally abused because he witnessed the mother being abused, or the father. But the majority of the cases are the mother.
Yeah, no, that's very good information. A lot of comments coming in saying, you know, good information and good advice. Something that someone mentioned was, how do you deal with a spouse who has a diagnosed mental illness, such as like bipolarism, depression? They're saying that, you know, that's obviously a very difficult situation to be in, 24/7, trying to manage it. So, Dr. Shatha, do you have any advice for that?
Well, it is challenging when you have a spouse with bipolar. It's definitely different than depression, because with bipolar, you have the mood swings, you have the anger outbursts, you have the mania that you have to deal with, which a person, when they're manic, they can lose all their money, they can go speed and get in trouble, they can get in, you know, spend the family savings. So it's a lot of radical actions, and with those mood swings. So definitely, if you are married to somebody with bipolar disorder, person has to take responsibility. You know, you could beg them, and you could talk to them, and you could give them all kinds of advices. But if they don't want to take responsibility of their mental illness, of their life, and feel better, then you're going to be knocking your head against the wall. So you have to encourage the person to, to want to get help for the happiness of the family, for the children's sake, for their sake, because they want to enjoy their life better. Somebody with bipolar, they definitely need medication because it's a hormonal imbalance. So they definitely need medication and need counseling to realize how to control when do they be cognizant of the manic episode when it starts. When they start feeling this symptoms, then this is the onset of the manic episode. So, and they can also, the spouse can notice that change from being depressed and all of a sudden now they're very elated, happy, energized, they're going, and so the spouse can remind them of, this is what's going on, and make sure that they are taking their medication, and show them support and be understanding. Depression, I mean, I would always encourage the person themselves to take responsibility. You can, whether it's your son or whether it's your spouse that is depressed or anxious, you can help them, you can be compassionate, but honestly, it is very important that they go to therapy, they reach out, they need medication, they have to take medication. Yes, you can include in your program, in your, to go out and do fun activities, or to yoga together, or to walk together, or to bike together, go to the gym together. This is doing as a family to help each other feel positive. Encouragement of, let's just stay positive, let's do this. But I think a lot of that has to be done also by a professional.
Mm.
Bipolar is one of the most serious mental illnesses. And unfortunately, it's also one of the mental illnesses where the patient really has a hard time initially accepting the diagnosis. It's one of the more difficult ones, and definitely has to be, controlled by medication. And they're among the ones that have the hardest time maintaining themselves on the medicine. The family's role often is to assure that they stay on the meds. So good luck, whoever is with a person with the bipolar. And I also would like, if the bipolar person is listening, that she adhere to the meds and try to be, compliant with the medication. It's a tough one, but life, if anybody told us life was going to be easy, they were lying to us. Mm-hmm. So there are so many challenges, and this is a much more of a grave challenge for any family. And some of us have had to live with that, and but it's doable. Depends on how much the person, like Dr. Shatha said, if they are willing to participate.
Somebody likes the music.
It's my phone.
Yes.
Okay. I forgot. We're not at a concert. The only time anyways, so the bipolar, so many artists that suffered with it. They're usually very creative people. They're lovely people usually. They're fun to be with if they maintain themselves on the medication. They're the most fun people to be with.
There are many successful people who have bipolar.
Yeah.
Yeah, it is not like a life-death situation. You can control it. You can stay compliant with medication. You can be very successful. You can be very happy, lead a happy life. But you need to know the symptoms and how to control them and stay compliant with your medication.
Yes. Yeah.
I had someone that made kind of like a comment that should be addressed along the lines of mental health. Saying that basically a lot of the families that come from overseas to the US, they're used to relying only on family and discussing these types of like personal mental health issues within the family bounds. So how do you get somebody who has that mentality to take it seriously enough to see a mental health professional? Because I mean, I've seen it, within my circle where people think, we don't do that, right? Like we don't go see a psychiatrist or a psychologist. Like we don't need that. As Muslims, a lot of them will say like, oh, just go pray or read some Quran. And it's just like, that's obviously not, it's good to do that, but obviously that's not, an actual medical answer.
No, but we have a lot, by the way, there are variations in our community along those lines and different Arab countries, it depends. For example, this is my own personal, and I've done some studies in the past, nothing recent, but the Lebanese seems to be among the most sophisticated when it comes to mental health issues. There is, so we have differences among our communities. It depends. And frankly, it's a matter of knowledge and the knowing about mental illness, knowing about you know, the different kind of mental illnesses. There's a big distinction among the different mental illnesses. There's the most serious ones, and then there's, you know, you have the ones that are in between. I think the people who seek the most help in life, usually, if you're very depressed, when you feel awful, of course you're going to go see somebody. Nobody's going to tell you to go see somebody. You're going to see because you feel like you feel so bad, you know. Then if you're somebody who's making others around you feel bad, they, you know, it's others who are going to bring you by force to see somebody. So you have all these variations. So it's very difficult to make a general statement about all. But in general, and then you have two kinds, by the way. There are people among us who seem to love medicine. They cannot wait to be put on medication. They love it. And then you have ones who say, I will never take anything. No, 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 I will not, you know. So there are some who like medicine no matter what. So you have all these different variations. And if we have any specialty, us in my field and Dr. Shatha, is we hopefully have a way of being able to communicate with a person who ought to be on medication, for example. For me, I feel that the most important role I have as a psychologist who I've gone to so many of the psychopharmacology courses at Harvard, I really am not someone who believes in medicine to the hilt, but I believe in it when it really is necessary. And I think my role is to be able to help somebody accept the medicine. And it takes a lot to be able to talk somebody into it, by the way. Especially if you have people who are, we have a lot of people, we are suspicious by nature in general. We don't trust people easily to begin with. And then so there's that element to work with our community. But if we have any expertise, Dr. Shatha and I, and others, we're not the only ones in our field, it's being able to talk people into taking the right medicine, making the right choices in life. We have been trained to do that because people think that it's only advice, it's only this. No, there are ways we have been trained to do something in a different way, to be able to help others to at least come up with the right decision about many things in life. To include that of taking the right medicine for the right illness. Now, the other issue, by the way, medications are not that easy. That's why some people really fight them. Medications take a long time to work.
Yes.
Now we're seeing this even with this darn corona. So medication is a big issue. It's not that easy. It's not aspirin. Even aspirin has side effects. So you have, especially with the antidepressants, my goodness, it takes 3 to 4 weeks maybe. And then some people give up, you know, it doesn't work because they want something to be magic. These are very complicated issues, especially when it comes to medication. And even with the psychotic disorders, you try so many different ones. The same one does not work with the same people. You know, you have to keep trying. And look at the patience it's going to take from the family. I mean, this is the kind of thing, it takes a lot of love and caring, a lot of it, to take care of the people with those kind of issues, with severe mental illness. My heart goes out to any family that has to deal with those kind of issues. This is not an easy task. And, you know, too bad that we are, you know, a lot of the people here in this country especially don't even have the support system they need to deal with all of that. That's a lot, especially in a country that's so individualistic, with so much pressure, financial, emotional, and so on. It's anyway, you opened up a Pandora's box for me.
Yes.
Where I get very, okay.
If I can add, you know, the stigma of going to a psychologist to reach out for help, it's very tough for our community. And, you know, even Lebanese, you know, or Iraqis or wherever you are, you know, people are individual and they approach things, situations differently. However, they do in general have that idea, I don't need to be, you know, seeing a psychologist. I don't want anybody to think I'm crazy. Mind you, this is very confidential. When you go to a psychologist, if I see my patients in a restaurant, and I tell them that all the time because it's a small community, if they're Arab and I see them in the mosque or in the restaurant or somewhere, they are allowed to say hello to me. but I will not say hello to them because I want to, I respect their confidentiality. You know, they could say hello to me as a friend or they know me, but I do not acknowledge them because they may be with somebody that they don't want to know that they're going to a psychologist. So it's a very confidential. This is something for you to go out and reach for help. Now, you know, like I said, not everybody we see are psychotic or have psychotic. I've seen many people, and my heart goes out for people with psychosis. But a lot of issues we deal with are stress-related, life management, basically. Which now it's very hip for many people to say, "Oh, I have a life coach." So basically, a life coach will tell you how to manage your anxiety. What do you do with your marriage to make it work? How do you do a better parenting? This is life coaching. So whether you approach it that way or as a psychologist, it's basically learning skills. If I am a very anxious person, I'm talking about medication. I do not advocate for medication when patients come to me first. You know, I teach the people skills. You have to have a basket of skills, whether to deal with your anxiety or stress level or parenting or mood disorders such as depression. You need to change the way you think about situations and you need to behave differently. So it's a lot of it has to do with how negative, how positive we are, how we interpret situation, how we manage our life, and how behaviorally we start doing things differently. Now, if he does all that, and he's still very anxious or depressed, then I will many times say, there are herb medications, there are herbs that they can take for stress mood or for, oh, I see that I am muted by you.
No, I unmuted. Sorry, that was an accident.
Okay, so there are many herbs that can help with anxiety, with depression, with the sleep. And if they are, you know, many people don't want to take medication, but in case of bipolar, you have to take medication. If the herbs are not helping you, then there are many good medications that have been there forever and will help you with those, you know, those disorders. So, yeah, basically, we want to normalize it to people that it's okay to reach out for help and it's okay to learn the skills. We're not, you know, if you think about it, you get married where you have no idea how to manage a communication, you have no idea how to make yourself happy, you know, or the other person happy. You don't know how to express anything. You know, you have children and you don't know anything about parenting skills. We jump into things we don't have skills. I wish if there are courses that prepare children, teenagers for psychological well-being, you know, how to communicate, how to do anger management, these are all very helpful skills. So if you went through life and you have not learned anything, then by all means, go to professional and say, this is my problem, how can I get help?
Mm-hmm. No, that's very true. I'm not sure Dr. Nuha's video went out. I think she's still there on audio though. I think those are basically all of the questions that came in. So you guys did a wonderful job. Some questions actually came in while you were speaking, Dr. Shatha, but you answered them as you were speaking. So that's always a sign of a very good speaker, is when they automatically cover the questions before they're even asked. So a lot of good comments coming in, thanking everyone on the panel for the expertise and ADC for putting this together. So I can say that we probably, you know, were able to answer a lot of questions for our community. And as we mentioned, this is an extremely important topic, and I'm sure we can expand on it and host another webinar on different topics that the community will benefit from. And so I'm going to give it to you, Dr. Shatha and Dr. Nuha, if you guys have any closing remarks, and then I will have Dua also close us out as well. No? Okay, that's fine.
Okay, I like to add that we are in a very stressful time, so I would encourage everyone to practice relaxation techniques, you know, whether meditation, mindfulness, yoga, exercise, go out for a walk, fresh air, it's amazing. It will calm you down. Exercise will release the tension from the muscles, will introduce the good hormones that make you feel good and get rid of the cortisol, that is the stress hormone. That's what will improve your immune system. Eat well. Don't watch so much media because that will all increase our anxiety. Enjoy the time, whether you're alone or with a family. Do things that you always put it away. Now you have time to do some hobbies or some things that you always didn't have time for. And basically be kind to yourself. Be kind, compassionate to others around you. For those who need your help, even though we're isolated, we can connect with others through the Zoom, through the iPhone, so many means. Connect with others. People like to hear your voice, make sure you're okay, and vice versa. So don't disconnect from your loved ones, even though you're in a different place or isolated. You can always reach out, and that will make you feel better. And good luck to everybody. Good luck.
Thank you so much. Dr. Nuha, are you still there?
I'm still here,
Okay.
and I just want, there's not much I can add to what Dr. Shatha. She's quite articulate and very eager to give a great deal. I'm wanting to wish my community the best, and I wanted to make sure that they do follow some of the instructions we gave about staying well in terms of, you know, exercising, the yoga. And then in addition to that, the communication skills. This is a time to really improve on those. That's a tough one. We're not the only community that has a tough time with that. This is not uncommon. And I wish you all the best, and just stay connected. And I hope that we pass through this without much, you know, much pain, and hopefully with much to gain, actually. It depends on how we deal with it.
Mm-hmm.
And stay.
Absolutely.
Okay. And thank you, ADC, for being such a great support to our community.
Absolutely. We couldn't do the work that we do without obviously the support of members of our community who are the doctors and who are the frontline workers right now dealing with a lot of what's going on. My sister actually works at a hospital, and so every day that's like something that's on my mind, worrying about whether or not she has enough protective gear. And so this, you know, this crisis that has hit our community obviously affects all of us in so many different ways. But at the end of the day, as a community, we're stronger when we rely on each other and we uplift each other and recognize the good work that we all do. You know, I want to thank the ADC board, and I want to thank obviously Dr. Shatha and Dr. Nuha for your opening remarks, which were very powerful. My staff here in Washington, D.C., we're all working remotely right now. ADC is still working for our community. We have the census that we have been pushing, came out last week, and we're encouraging all of the Arab Americans to make sure that you're filling out the census form and that you're filling out your specific ethnicity when you fill it out, such as Palestinian, Lebanese, Moroccan, Tunisian, Sudanese, however you identify. It's important that our community gets counted, because in times like this, in this crisis, this is where we see the information of the census actually play out. This is how they allocate resources. This is how they know how much help is needed per community, the types of people who need that help. And so I encourage everybody to make sure that they go to the census website and fill it out. We have a video on our website that we recorded on a step-by-step way to fill out the census. And, you know, ADC always thanks the community for the support. So if you feel like reaching into your pockets and helping us out as we continue to work for you, you can go to adc.org to make a donation or to make a pledge. And hopefully, if you guys have any other topics that the community feels is important, please reach out to us and let us know. We would be more than happy to get our experts from our community online so that we can continue to provide this information for everyone. So with that, I'd like to say thank you and stay safe, stay home, more importantly. And I will be sending a recap of this to all the attendees, and we will be posting this video on our social media as I was recording it, and that way you guys can share it with your community and your families who were not able to attend. So thank you again.
Thank you, Janan. Thank you so much. Thank you so much. Thank you.
Have a great day. Thank you.
Thank you. Thank you.
Bye-bye.
Take care. Yeah.